should doctors and teachers strike over pay rises? Millions of public sector workers in England have been offered a pay award above inflation, which is currently at 3.5%. Ministers haven't budgeted for such a rise, meaning some of the money will have to come from, just to be clear, existing school and healthcare budgets. There have been threats of strike action. Doctors say the pay award doesn't go far enough in restoring historical pay limits and freezes. And health unions aren't happy that nurses and midwives have been offered a smaller 3.6% rise. Now, Bobby, here's a question. Let's go to your area of professional expertise, teachers. Currently, teachers earn 31,000 is the average, 31,730 pounds to just shy of 50,000. That depends on their responsibility. With a 4% average, with a 4% pay rise, this comes from the Times Educational Supplement website. The starting salary for a teacher, averaged, I must be clear, is 33,000, going up to 51,000. Would you support a strike?
Absolutely, and I'll tell you why. So, in this country, education is perhaps one of the most important things that we have as creating a levelling playing field. Tony Blair, before 97, said education, education, education. Rishi Sunak even talked about education being the silver bullet to solving our nation's problems. Yet in this country, the people that provide the education for our young people, we're massively compromising their ability to teach. And I'll tell you what's happened is in the last 15 years, since 2010, there's been a pay freeze on teachers. And what this meant is, in terms of real terms, it's been about 20% pay cut. And the way to consider it as an analogy is, teachers who started in 2010 compared to now, you're now being asked to work that Friday for free. That's what a 20% real terms pay cut is. So the government has offered, was it 2.6%? So all teachers are asking for is trying to find a way of restituting that pay. And again, as someone that worked in the city as an economist, I always look in terms of supply and demand.
Right.
If teaching the pay was so great, would we see a profession where 1 in 3 teachers leave the profession within 5 years? No.
Can I just also refer to what I was saying before, which is, look, they haven't budgeted for this, so they need to get the money from somewhere. And I'm going to ask you about how that works in the classroom and in the school in general. What they're asking, effectively, is say, well, we're going to pay teachers more, but to find the money, we're going to reduce resources in school in order to fund this. What does that mean in real terms when you're actually teaching in a classroom or running a school? So
this is one of the biggest issues for school managers, because it's all well done and good for the government to say, oh yeah, we're going to give you a 2.6 or 4% pay rise. But if they're asking it to come from existing budgets, what it means is the school finance officer has to look at all the school finances and say, actually our special educational needs, actually our buildings repair, actually our recruitment of new teachers, we're going to have to cut that to pay for the
Get rid of art, get rid of drama, get rid of all the stuff that you get if you are in a private school. But if you're in a state school, forget about it. And then, of course, the great gap and divide between those who have privilege and those who don't. So if we're interested not in equality of outcome, but equality of opportunity, that disintegrates unless you can adequately fund those resources in schools, is the point that you make. And I suspect a lot of people in the country do as well. And you know, it's all very well to perhaps increase the amount teachers are earning, but it has to come from somewhere. It's an odd thing to take it from school.
Of course it does. And once you get pay rises, as you have with the doctors, which are above the rate of inflation, then you're actually fueling inflation. So you're fueling the problem continuing. So I am not in favour of that level of pay rise. And I think what you've got to do is what Thatcher did, which was to just say, look, there's got to be a queue and we can't do everything at once.
Do you agree in principle they're entitled to more money, or you think they should be paid more money?
I think maybe because of historical anomalies, it might be the case that they should get a little bit more, but not more than inflation.
That's uncharacteristically opaque for you.
Hang on, but not... Let me finish the sentence.
OK.
But your profession and its interruptions. But I don't believe for 1 second that this is the right time to give anybody a pay rise above the rate of inflation.
Right, so you would say, I'm really sorry, teachers, you do a good job, but you're not entitled to more.
I think there's a mischaracterisation of wages leading to inflation, because people often in the media will go, maybe centre-right will say, if we pay workers more, it leads to this wage price spiral, inflation. But actually, if you think about inflation, a lot of it's about the government printing money in the last few years, quantitative easing, and that's flooded the economy with money. And I think it's unfair to punish workers in public sector for that.
Well, let me just move on. We've got teachers. Sorry, Anne, I want to get... I want to hear from nurses, Anne, for a second.
Okay.
Because nurses, what this means in real terms, for example, they've gone from 27,000 in 2020 2022. In 2023, it was around that sort of money, and £31,050 this year. That's the average amount for a nurse. It's an increase of around £4,000, but that's in the last 3 years. Julie, £4,000 in 3 years, given what you've been asked to do. Would you go on strike, or do you think this is a fair deal?
No, I would never go on strike. I would never ask another nurse to go on strike, because I won't ask somebody else to do what I won't do. But it has to be sorted. The NHS needs a good sort out. Where do we get the money from? We get the money by putting more tax on alcohol, more tax on tobacco, and more tax on gambling. Plus the fact, as I say, the NHS is probably like the prison service and probably like education. People leave because they're disgruntled. Right. It needs to be sorted out, and I think Miss Anne Whitcomb is the lady to do it.
Oh, thank you very much.
Well, I mean...
Maybe we should keep the Shakos Island and use that money.
Now, I hear what you say, Julia. I just wonder, what's morale like in the hospital that you work in, amongst other nurses?
Well, I'm retired now. I'm rotten with osteoarthritis, unfortunately. Okay, but it wasn't very good. It wasn't very good. And you're giving doctors 5%. Well, why not give nurses 5% as well? I know Miss Whitcomb will not like that because it's above inflation, but believe you me, behind every good doctor, there's an even better nurse.
Right. Thank you very much, Julie, and thank you for what you did, years serving in the NHS. Sylvia, you're in Durham. Do you agree that it's time to give nurses a bigger pay rise? And certainly, we were talking about teachers before. Don't just give them a pay rise and then take money from the school.
I don't think teachers should be striking, no, because it's the very people who want to strike keep saying about children who are not going back to school after COVID, they can't get them back in, or if parents take them out for a holiday, they complain about that and they get fined. So, no, I don't think teachers should fine. Do I think they deserve the money? Yes, of course I do.
So, Sylvia, would you ban teachers from striking and people who serve in our national health? So you'd make it unlawful?
Yes. Yeah, I would, because I don't think teachers should strike. I think they need to be in school to teach and protect our children.
Well, that's interesting. I hear Anne to the left of me agreeing, and you make your point clearly. Thank you, Sylvia. Ellen, you're in Northumberland. You've heard what our nurses have said. Just the money's not good enough, and they provide a critical and essential service. They deserve more, do they?
Yes, they do. And teachers do especially. They deserve 3 times the amount of pay rise that they're going to get. I volunteered in a school, at a Catholic primary school. I've never known a school like it, ever, not ever. The fairness, there's no favouritism, and the pupils approach the teachers, they're allowed to go to the toilet when they want, and things like that. It's absolutely out of this world. And one teacher, because this little child was slightly mentally challenged, she carried her around on her back for all one lesson because that's what the little girl wanted to be. Right. Did you ever hear tell us such a thing?
Well, thank you, Ellen.
Teachers deserve far more.
Well, Ellen, I mean, many school leaders and teachers do extraordinary jobs, and increasingly, as Bobby was describing, with shrinking budgets. And especially in state schools. And if you care about long-term equality and of opportunity for everybody, that's the point that Bobby was making, that those schools need adequately to be funded. Before I come back to the panel, let's go up to Greater Manchester and hear what you have to say about this. And the question is not just about whether these people deserve the money, doctors, nurses and teachers. Most people say yes, they do, but whether or not you think they should strike if they don't get their way. Do you think they should be able to? Anne?
Oh, yes, speaking. No, definitely not. Doctors should not strike. They take the Hippocratic Oath, and when they're clerking patients in, especially possibly very poorly or terminally ill patients, how can they look them in the eye knowing that they're going to walk away from them? Definitely not.
Well, can I tell you, Anne, a consultant working in the NHS with a 4% pay rise, their money has gone from just shy of 110,000 to over 145,000 a year. In those circumstances, do you think that makes your point even stronger, that the money is sufficiently adequate not brilliant, but adequate for their expertise, that they should be banned from walking away from their surgical duties and obligations to their patients?
I think the money is adequate because a lot of consultants in the National Health Service do a lot of private work at the weekends or perhaps half days, and they make quite a lot of money doing private work.
Well, thanks very much, Anne. Now, you've heard what's been said. It's interesting because you work actually at the coalface of this. There's somebody phoning in to say that teachers and other public service workers should be banned from striking. I hear Anne, who we'll come on to in a second, agreeing with that. Do you think that that's right?
Thing is, I think every employee, apart from maybe the absolutely most critical ones, have the right to withdraw their labour. But it's about teachers trying to protect the future of the profession and schools. Because if you let education being run roughshod by consecutive governments, it means that you ultimately compromise the ability of people to deliver the service that we think is so important. So I think, teachers, when they enter the profession, striking is the very last thing they think about doing. But without doing that, you need that in terms of negotiation.
You'd ban it, would you?
I would. I mean, the army can't strike, police can't strike. I would actually apply that to all emergency services where lives were involved. So I would apply it to ambulancemen, to the NHS, all workers in the NHS,
teachers
where lives are involved, and this is what I was coming on to. And I would also apply it to teachers because if they do withdraw their labour, the net result is the children aren't being educated, and that's our future as well as the children. Hang on, I didn't interrupt once.
Okay.
Well, he's allowed to. No, come on, Bobby.
Granted, but I didn't interrupt.
You didn't, but Bobby, actually works in the school system.
No, what I was going to say, Anne, is if teachers weren't allowed to strike, it leads to worse pay conditions. And ultimately, people are not joining the profession, Anne. So that's why we're having teachers where we've got classes of 30, 35, 40, etc. more, because young people are looking at all the options, thinking actually teaching looks like a rough deal.
Right, if I can just speak. I have to say that teachers I've spoken to who have left the profession don't actually quote pay. What they quote is lack of discipline in schools, chaos, parents, who are impossible, all the rest of it. I think we need to look at quite a lot before we just worry about the pound, shillings and pence. But I think they shouldn't be allowed to strike.
Well, here, that's schools. But let's go over to another one of our nurses. Colleen, you're in Kent. You know what this pay rise is offering nurses. Do you think it's enough, or do you think enough is enough and nurses, frankly, should withdraw their labour, as Bobby describes, and strike? What do you think, Colleen?
Excuse me. Well, firstly, good morning. But I do believe that we have a democratic right to strike, which is the first thing I'd like to say. But secondly, there is nobody in the public sector who chooses to go on strike willingly. It's not something that is the first thought that we have. We get to a point where if nobody is listening to what we are saying, we go on strike because of our patients, because we can't care for our patients. We don't have enough staff. I have just been to the Royal College of Nurses Congress in Liverpool, only just last week, and the morale is on the floor. We honestly do need more people in the NHS, and I do believe that this needs to be a cross-party subject.
Can I just ask, I don't mean to interrupt you because you're in full flow and you've got important things to share with us, but it's something that Anne just brought up, that the morale in the NHS and in the ward isn't necessarily just about pay, but about the conditions that nurses are working. Do you say that that needs to be improved, or is it just people won't come into the profession because the money isn't good enough?
I think it's a bit of both, because obviously nurses, teachers, we all have to pay our gas bills and our mortgage the same as anybody else. It might be a vocation, but it's not a vocation that gives us free energy. But there's lots of things that we could look at, because, for instance, nurses pay to be registered to be nurses, which is quite a lot of money. Right. We pay for parking. We pay for every bit of food that goes in our mouth when we're at work if we get time. Right. It's not free. Childcare. Now, you could look at things like that. Instead of just saying we'll give you a 3.5% pay rise, we could look at ways to give nurses money in other ways, but we have to get people into the profession. This profession is a degree profession.
Yep.
Nurses have master's degrees, the same as teachers, the same as consultants. Why are we not being treated the same?
Well, thanks very much, Colleen. It's also worth remembering, I think you have to pay to do that degree as well, so people arrive in the profession already in debt. Thanks, Colleen, for your insights. Really interesting and I have to say illuminating as well. I wonder whether the government is listening to you. If they're not, I suspect this panel would agree that they probably should. Later.